Aging is an inevitable natural journey, but accepting memory loss and declining cognitive abilities is something we should not do. As people enter middle age and beyond, many often mistake minor, everyday forgetfulness for the initial signs of serious disease. However, the ability to implement early detection of cognitive decline, a medical term describing significant changes in memory, language, or judgment ability, is the golden key to timely intervention, slowing the progression of the disease and preserving the quality of life for many years to come. Grasping the subtle differences between normal forgetting and actual warning signals can make a huge difference between living independently and requiring full-time care. Everyone has moments where they forget an old acquaintance's name or where they left their car keys. That is normal aging, where the speed of information processing slows down slightly. Conversely, mild cognitive impairment, MCI, is the transitional stage between normal aging and dementia. In the MCI stage, the cognitive changes are significant enough to be noticed by relatives and the individual themselves, but the person still maintains the ability to perform daily living activities independently. Detecting and managing MCI is a crucial focus, as a significant percentage of people with MCI, about 10–15% per year, will progress to dementia, primarily Alzheimer's disease. Early identification allows us to proactively intervene with lifestyle measures, thereby minimizing or delaying this progression. For early detection, the most critical step is recognizing the true warning signs, which go beyond typical forgetfulness. The leading sign is repeated difficulty with newly learned information. A healthy older adult might forget the name of a movie they watched last week, but they can still recall the details of the conversation they had last night. Individuals experiencing cognitive decline frequently forget recent events, ask the same questions repeatedly without realizing it, or constantly need reminders from relatives about tasks they have completed. Another key sign is difficulty with planning and problem-solving. This manifests as an inability to manage personal finances effectively as before, struggling to follow a familiar recipe, or taking significantly longer to complete complex tasks. Language skill decline is also a strong indicator. The individual often pauses mid-sentence, cannot find the correct word to express a thought, the word-finding difficulty phenomenon, or substitutes common words with irrelevant ones. This makes communication challenging and frustrating for both the speaker and the listener. Alongside this is disorientation to time and place. Forgetting what day or month it is, or getting lost in familiar areas, such as the route home or a nearby supermarket, is a red flag that requires attention. Changes in behavior and personality are also part of the picture. The person becomes passive, less engaged in previous social activities, or becomes unusually irritable or suspicious. The early detection process must begin with routine screening and clinical assessment tools. For individuals aged 65 and older, or anyone with risk factors, family history, diabetes, hypertension, primary care physicians or geriatricians should use quick, simple cognitive screening tests during annual checkups. Common tools include the Montreal Cognitive Assessment, MoCA, or the Mini-Cog. These tests only take a few minutes, but help quantify the decline and determine if more in-depth specialist evaluation, at a neurological clinic, for example, is necessary. If initial screening results indicate a problem, the next steps include brain imaging, MRI or CT, to rule out other treatable causes such as brain tumors, stroke, or vitamin B12 deficiency, along with comprehensive blood tests. Overall health and lifestyle play an extremely important role in preventing and slowing cognitive decline. Approximately 40% of dementia cases may be linked to modifiable risk factors. Therefore, early detection must be accompanied by active lifestyle intervention. First is management of cardiovascular and metabolic diseases. Strict control of high blood pressure, cholesterol levels, and diabetes is imperative, as the health of the cerebral blood vessels is directly related to cognitive function. Second is increasing physical and mental activity. Regular aerobic exercise, such as brisk walking, swimming, has been proven to increase blood flow to the brain. Simultaneously, maintaining intellectually stimulating activities, learning a new language, playing a musical instrument, solving complex puzzles, helps build cognitive reserve, the brain's ability to cope with damage. A frequently overlooked but critically important aspect is sleep quality and mental health. Deep sleep is when the brain cleanses itself of toxic proteins like beta amyloid, the main culprit in Alzheimer's. Chronic insomnia or untreated sleep apnea increases the risk of cognitive decline. Furthermore, depression and social isolation in older adults are not normal signs of aging, but are risk factors or precursors to pre-dementia symptoms. Detecting and treating depression can significantly improve cognitive function. In conclusion, early detection of cognitive decline is a joint effort, requiring the perceptiveness of family members, the proactiveness of the patient, and accurate intervention by the healthcare system. For older adults, any change in memory, judgment, or personality that affects daily living should not be ignored or attributed simply to old age. When warning signs appear, seek professional assessment. An early diagnosis of MCI or dementia is not a sentence, but an opportunity to start pharmacological treatment, engage in structured lifestyle intervention programs, and plan long-term care with the family, ensuring the remaining years are lived with the highest quality and independence possible. Protecting our memory is protecting ourselves,